So the third case, you are called to revive a 4-hour-old 25-week infant who is ventilated for the respiratory distress syndrome. And prior to this episode, she was in 30% oxygen on SIPP plus VG mode and needed pressures of 20/6 to obtain a tidal volume of 4 ml per kg. And she was maintaining at 100% of oxygen, and ventilator is now alarming due to the maximum pressure limit which is being reached, which is set to 25 centimeter of water. On examination, we noticed there is a fullness of the right chest and there is a decreased air entry on the right side compared to left, and trachea is deviated to left, and the pulse rate of the baby at present is 80 and the oxygen saturations were in 670s. Next slide. Next.
Okay. Jyoti, click for the post. Yeah, you already, okay, clicking brings the X-ray. It's okay. So you already got a pneumothorax, I mean, you have an X-ray with the pneumothorax. So in this case, would you wait for the X-ray, Dr. Akshatha?
No, sir, because we already on the examination is only we got the diagnosis.
What is the other important factor that you won't wait? The baby is collapsing.
Baby
you have
is
a heart rate of 80, so baby will arrest if you don't treat immediately.
We have to get an emergency.
Yeah, so this is an acute emergency. You already have a clinical diagnosis. Most of the units have transillumination. So obviously you would not wait for the X-ray. Most X-rays take 10 minutes at least. So you would, what would you do as a first step? Maybe Dr. Dharani, you want to answer? Please unmute yourself. Okay, Dr. Kavita, please unmute yourself. Speak.
So emergency needling can be put, sir, and followed by that we can insert an ICD.
Okay, so the needling, can you describe how you do it?
In the second intercostal space, so in the mid clavicular line, we can take a needle under aseptic precautions and just put it. And
which needle are you likely to use?
Usually either a butterfly needle can be taken.
Any other option which is safer?
A 26.5 gauge needle or IV.
So a Venflon is better.
Okay.
So you have the 20 or 22 gauge Venflon. The advantage of that is you connect a 3-way tap and you can leave it there till you decide on the chest drain. You can drain the air again if needed. If you put a butterfly needle, if it stays in the chest when the lung is opening, it can tear the lung. So you would, once you drain the pneumothorax, you're not keeping the butterfly needle because it's not safe.
Just a temporary.
It's only for acute drainage. If you don't have a Venflon of suitable nature, you can drain with the butterfly, but you can't keep the butterfly there. As the lung expands, it may tear the lung. So you have to be careful with butterfly needle, but either you use a 3-way tap or an underwater seal and you remove the air accordingly. And the chest drain, I mean, if it's a tension pneumothorax in a ventilated baby, invariably you put a chest drain as well. I don't know if any of you use a pigtail catheter. But mostly, are you using a trocar or a pigtail catheter in India?
Trocar we are using, sir. Number 10, number 12.
So on the left side, you have to be very careful. Always do the blunt dissection before you put, because you're going to use inadvertent force. And there are cases when I was training, even we had one case where the heart was punctured. So we have to be careful with the left side, especially do a blunt dissection to the muscle and then insert it without too much of the stress. Okay, next slide.
Next slide.
So obviously, once you have the chest tube inserted, I mean, you have to connect it to the negative section as well, and how you remove it and all depends on the severity and how long the bubbling takes place. First, you stop the negative section, then you clamp it for some time, do the chest X-ray, and then decide. So surfactant therapy, this baby was already on volume guarantee. I had received surfactant, but it's an extreme premature baby, so we can't predict why the air leak happened. Because on volume guarantee, you're supposed to be protected to some extent against these problems, but you can't predict, and each baby you have to be alert and manage. Okay, next slide.